Good day. This is Jerry Mayberry with Echosens North America. In this short video, I will provide an orientation to the functions of the MyFibroScan application, which is available to any user of the FibroScan device. First of all, you'll want to download the MyFibroScan app. You can go to the App Store at either Apple or Android, search on the term MyFibroScan, and download the app free of charge. Please be aware that the iPhone, iPad, and any Android device is compatible with the application. Let's take a look at what's available in terms of functions that you can perform once you've downloaded the app. First, you'll notice there's a tips section that will provide you good information on best practices as they relate to FibroScan testing. There's also a publication section where you can see any reference publication that's posted within the MyFibroScan app. There's also a convenient BMI calculator, and in the near future, there'll also be a calculator for FIB4 and NAFLD fibrosis score, making it very convenient to calculate what you need when you're dealing with a fatty liver patient. Finally, at the top is what I believe is the most time-saving, most valuable function within the MyFibroScan app to the busy provider. This is a section that will minimize the time and effort required to compare a patient's test values from a FibroScan to published threshold values. Let's take a look at how it works. So here you see a screenshot of an iPhone. Let's launch the MyFibroScan application. And we're going to pick interpretation guides. And then we're going to type in the CAP value from the patient and also the liver stiffness value from the patient. And then we're going to pick the disease. In this case, we're going to pick hepatitis C and click Submit. Now the MyFibroScan app is comparing these patient values to published threshold values, and you can see it produce this graphic showing where your patient stands on these scales. You can also take a look at the publication to get specifics on what cutoffs it's using, and you can also review the publication right from the app if you want to remind yourself of something. And you could also change the publication that you're using as your reference. Let's pick Costera. And here you see the cutoff values from Costera et al. So that gives you an idea of the kinds of things that you can do. So let's review what would actually be produced on the screen. So Echosens does not publish or promote any specific set of threshold values. All we do is make it convenient for you to compare your patient's values to published reference sources. And so you will be in absolute control of selecting what published threshold reference you want to use on each specific patient. So I want you to notice in this case, we have a hepatitis C patient, and that patient's values for CAP and VCTE are entered above. Then you'll notice that whoever did this picked Sasso et al. As their CAP reference publication, and they picked Ofdal et al. As their VCTE reference publication. So based on the values of this patient and the thresholds within those publications that were selected, this graphic is produced. So for example, if you look on the fibrosis stage from the liver stiffness VCTE test, you can see your patient's value of 8.7 falls into the F2 area compared to biopsy based on the Ofdal threshold. If we look over at Sasso on the CAP side, your patient's value of 264 falls into the S2 range based on the Sasso thresholds. So let's take a look at what publications are posted within the MyFibroScan app. This is a very objective process to select what is available for you. So the requirements within Echosens are that the publication has to be peer review. It has to use FibroScan VCTE as an assessment of liver stiffness. It has to compare those liver stiffness values from VCTE to biopsy for both fibrosis and steatosis. And finally, the publication has to match the disease that the patient actually has. So over on the right side, you can see an example of threshold value options that would be shown. Let's take a look at each disease. For example, if you were to use your MyFibroScan app and you were to set the etiology to hepatitis C, you would notice that you would have 3 threshold value publications from which to choose. In this case, you'll notice Afdal et al. Is highlighted, but it is completely up to the clinician to appreciate, understand what these publications say, and pick the publication that they find to be most applicable for their patient's condition. If we look at co-infected HIV, HCV, you can see we have a choice of 2 threshold value publications. Hepatitis B, there's a choice of 3. Alcoholic liver, a choice of 3. PBC, a choice of 2. And finally, autoimmune hepatitis, a choice of 2. Now let's move to the more complex topic of NAFLD-NASH and VCTE thresholds. So I want you to notice there are 5 publications listed here, but actually what there are 3 publications listed, but we're adding a level of functionality and complexity, because if we look at the NASH CRN publication from Siddiqui et al., we will notice that it actually has 3 threshold values based on the preference for sensitivity being 90%, specificity being 90%, or the preference to use Yoden's index, a balanced priority threshold. So what that would do is you would pick whichever of these 3 that you preferred based on the patient's condition and the patient management decision that you want to make. For example, you might pick the sensitivity priority if you were trying to get high negative predictive value. I also want to point out that a future option will be Eddowes et al., the publication I'm displaying, will soon be added under NAFLD-NASH, and this publication also provides sensitivity priority, specificity priority, and Yoden's index priority as you prefer. If we take a look at how that would work, if we were using the Siddiqui et al. NASH CRN publication, notice if you selected sensitivity priority that it would use a threshold of 6.5 kilopascals, which is what provides a sensitivity of 0.90 as compared to biopsy. If you were to pick specificity priority, the threshold that would be used would be 12.1 kilopascals, which gives you a specificity of 0.90. And if you pick balance priority, it would use 8.6 kilopascals. So let's talk a little bit about cap thresholds. So you're going to have 2 choices when it comes to picking your cap thresholds. And in the very near future, we will also be adding Eddowes et al. To these choices. And for cap, Eddowes et al. Will provide, again, 3 choices: a sensitivity priority, specificity priority, and Yoden's index priority. So that will be available soon. This concludes my explanation of the MyFibroScan app. We'll be adding more features in the near term, and please expect more videos on this